Malaria and babesiosis refer to disease processes resulting from infections of parasites belonging to the phylum Apicomplexia. Their respective genera are Plasmodium and Babesia. Both genera of parasites belong to the class of parasites that have no obvious structures for purpose of motility known as Sporozoa. Of approximately 200 known species of Plasmodium, only 10 have demonstrated the ability to cause infection in humans. But in this chapter, we'll only be discussing the 5 most important and the 4 most common uh, Plasmodium infection. So as noted, there are 5 species of Plasmodium known to be of concern regarding transmission to humans. But wala lang na to siya gi-appeal diri class kay the 5th Plasmodium is very rare. Okay? So the general morphology for our Plasmodium, we have 6. So first, we have the ring forms, or what we call the early trophozoites. The ring form, as the name implies, refers to a ring-like appearance. Yan, mura siyang sing-sing. Of the malarial parasite following invasion into a previously healthy RBC. So, ang RBC ang ilahang gina-invade, okay? The red blood cell. The typical ring, when stained with gemsa stain, consists of a blue cytoplasm, kaning iyahang blue, and a circle connected with, or to, depending on the species, a red chromatin dot. Kani class, kanang naa sa tunga. Okay? Kanang iyahang murag. Kung kaniyang sing-sing, kaniyang bato. Okay? Ang kanang bato, ang kanang iyahang chromatin dot. Also referred to in some texts as the nucleus of the cell. Okay? The space inside the ring, ang kaning puti, okay? That is known as the vacuole. The next stage is the developing trophozoites. The appearance of the developing trophozoites varies among the Plasmodium species. There is this cytoplasmic circle, kani, and chromatin dot gihapon para sa ato ang ring, which are in some cases both still intact until late in development. So, depending on the species of the Plasmodium, some developing trophozoite would still be intact na ring-like gihapon ang iyahang form, while others is naguba na class. Okay? So, pigment, primarily brown in color, is often visible. So, for this example class, may makakita tayong parang brown na color dyan inside the parasite, not inside the RBC, but inside the parasite, there is a brown pigment that is what we call the hemozoin. That is the product of the consumption of hemoglobin. Okay, kay gikaon man sa parasite ang hemoglobin inside the RBC, and the product is this brown pigment, which is what we call the hemozoin. Okay, next stage, the immature schizones. Although still unorganized, evidence of active chromatin replication is seen in the typical immature schizone. Visible cytoplasmic material surrounds the growing chromatin, kaning ato ang mga chromatin, kanang mga dots, and pigment granules, often brown in color, are also seen. Okay, katong pigment ganina, we can also still see here in this stage. As you can see here, these are the pictures for the typical schizone stage of the Plasmodium species. So there is an evidence of chromatin replication and very unorganized pa kani class, kalat-kalat pa ang ilahang mga ilang mga chromatin. And as the parasite continues to multiply, it expands and occupies more space within the RBC. So samtang naga-develop yung parasite, so it will expand. So kanina parang andito lang sa class, so ngayon malaki-laki na yung space na na-consume ng parasite inside the RBC. Next stage is the mature schizones. These are characterized by the emergence of fully developed stage of the asexual Sporozoa trophozoite known as merozoites. So, kani class, after developing What we call here now is these are the merozoites. And as you can compare from the previous stage, unorganized ang arrangement nila diri, while here na sila somewhat arrangement na. Okay? Next, the microgametocytes. With the exceptions of Plasmodium falciparum, which is crescent shape, the typical microgametocyte is roundish in shape. Kana class. Roundish ang mga microgametocyte. The compact chromatin mass is partially to completely surrounded by cytoplasmic material. So this is the chromatin mass surrounded by cytoplasmic material. Okay, ang kaning murag tail or halo niya nga part, that is the cytoplasmic material. And diffused, usually for this is your falciparum, diffuse ang iyang chromatin mass, while sa macrogametocyte mas compact na. And as you can notice that mostly or typically the chromatin mass of your microgametocytes are located near the center or sa center mismo, while the chromatin mass of the macrogametocytes are usually eccentric or naalang sila sa gilid, hapit na sila sa periphery. Okay, so the general life cycle for your Plasmodium species. Members of the mosquito genus Anopheles. Yan. Ang Anopheles mosquito are responsible for the transmission of malaria to humans via a blood meal. This vector transfers the infective stage, which is the sporozoites, from its salivary gland into the human bite wound. Following entrance into the body, the sporozoites are carried through the peripheral blood to the parenchymal cells of the liver. So, ang pinakauna nila na i-target class is the liver cells. That is the parenchymal cells. So here, they will be developing through schizogony, or this is the asexual multiplication occurs. This cycle is called the exoerythrocytic. So meaning outside the RBC, diba? Exo outside and erythrocytic pertaining to the RBC. So for this whole life cycle, we have 3 cycles. We have the exoerythrocytic, erythrocytic, and the sporogonic. So, ang pinakauna nila na adtuan na cycle class is the exoerythrocytic, which happens inside the parenchymal cells of the liver. So, after that, they will be developing into schizones inside the cell, and after magtubo and magmultiply inside the cell, tapos if daghan na kaayo sila class, sa sobra kadaghan nila, the cell would then explode, and this would introduce merozoites into the circulating blood. So, dili na magsugod ang ilahang invasion of the RBCs. So, this migrating of merozoites target age and size specific RBCs to invade and thereby initiate the phase of reproduction involving red blood cells known as the erythrocytic. Okay, simple lang. So, since na naman sila sa sulod sa RBC, so that means that this is now the erythrocytic cycle. So, inside the RBC. On formation of the merozoites, one of the 3 paths may be taken sa kaning trophozoite. Some of the RBCs infected with merozoites rupture, for example, releasing these forms to target and infect new RBC, and in this part of the cycle repeats itself. That is one. Another is other RBCs containing merozoites develop into microgametocytes kani class. So, pwede sila mag-develop into gametocytes, and still others are destroyed by the immune system of an otherwise healthy individual. Although never demonstrated in human infection, it is presumed that pwede din silang maging hypnozoites. Hypnozoites, these are dormant Plasmodium infected liver cells. And also these hypnozoites are also called the sleeping forms, meaning adto lang sila dito sa liver cells, but they would not further develop, but they would be dormant until na after a few years or a few months, they would reactivate and then magka-relapse ang patient. Transmission of the parasite back into the vector occurs when the mosquito ingests mature male and female sex called gametocytes. So ang micro, that is the male, and the macro, that is the female, okay? So kanig sila class ang masip sa mosquito, and then in the mosquito, the microgametocyte and macrogametocyte would initiate the sexual cycle of growth. And then from the ookinet, mahimo siyang oocyst. And then kadto na adto sila sa salivary gland of the mosquito, and then the cycle would repeat itself, and this is the sporogonic cycle. So gemsa-stained peripheral blood films are the specimens of choice for the laboratory diagnosis of malaria. Wright's stain may also be used and will result in an accurate diagnosis. Both thick and thin smears or blood films should be made and examined. Okay, in your laboratory, we should be able to make malarial slides. So this is the thick film and this is the thin film. So the thick film serves as the screening lang. Okay, screening lang ni sila class, whereas the thin blood smears are used in differentiating the Plasmodium species. So sa thick blood smear, diri lang nato ginapangita ang reporting as positive or negative for Plasmodium. Diri magtan-aw sa thick film. While sa thin film, diri magtan-aw kung unsa na species, or this is where we speciate and differentiate the different Plasmodium parasite. However, you should take note that there is also a mixed Plasmodium infection, and usually ang mga mixed na Plasmodium infection here in the Philippines are Plasmodium vivax and Plasmodium falciparum. And also, the timing of blood collection for the study of malaria is crucial to success in retrieving the malarial parasites. When the infected RBCs rupture, merozoites are present in the circulating blood. And pag katunang mag-rupture ang RBCs, this would initiate an attack to the person and to the immune system, and motong magka-fever and chills ang patient. So this here, between these fevers and chills, dapat magkuha og dugo, kay this is the best time na daghan og parasite sa circulating blood, kay na-release na ang mga parasite. In addition to blood film, serologic tests and polymerase chain reaction or PCR techniques for malaria are available. So this is the comparison between the thick smear and the thin smear. So in the thick smear, we only this is where we quantify the parasite if present, and also please remember that we must always view the thick smear first. In the thin smear, this is where we specify the malarias, and we don't usually use this for counting. Okay. So on to the first Plasmodium species, Plasmodium vivax. The common associated disease and condition is the benign tertian malaria or the vivax malaria. So the ring form of the typical Plasmodium vivax measures approximately 1/3 the diameter of the RBC. A single chromatin dot, that is a chromatin dot, and Also, a vacuole is visible inside the ring. Remnants of the cytoplasmic ring may be also visible pag naging developing trophozoite na siya. The parasite takes on more of an irregularly shaped amoeboid appearance. Kaya siya sinabing developing trophozoite na siya. A single large chromatin dot is present among the cytoplasmic material, and the vacuole remains visible and basically intact until the late stage of development. So the presence also of hemozoin, as I have mentioned a while ago, hemozoin is the brown pigment na product of hemoglobin degradation of the parasite. This is also visible as a brown pigment. Okay. Immature schizones or schizones. The immature schizone form of Plasmodium vivax is characterized by the presence of multiple chromatin bodies that emerge from progressive chromatin division. So, ang kanilang multiple chromatin bodies. Cytoplasmic material is present and often contain clumps of hemozoin. The continuing division of chromatin results in 12 to 24 merozoites. So, mo na ni ang mature schizones. These merozoites occupy most of the RBC. So, in some cases, dili na ni makita ang RBC na part class. So, ma-consume na ni, mapuno na ni og kaning mga chromatin bodies ang tibuok RBC. The microgametocytes consist of a large pink to purple chromatin mass when gem-sustained, which is surrounded by a colorless or pale halo kani. Evenly distributed cytoplasmic hemozoin is usually visible. So the macrogametocyte is characterized by round to oval homogeneous cytoplasm and an eccentric chromatin mass. Okay, o eccentric na pag microgametocyte more centered ang chromatin body, while the macrogametocyte has an eccentric chromatin mass. Okay, this is the view of your Plasmodium vivax ring form in the thick smear kani. While this too is the thin smear view. Okay, you can see this, the chromatin dot, the cytoplasm, and the vacuole. Also, very important to take note that your Plasmodium vivax only infects the young and immature RBCs. So, these young and immature RBCs are still soft and pliable. So, humok pa sila class. Ang walls sa RBCs ng mga bata is very flexible pa, pliable and malleable. That is why, pag magdako ang parasite, magdako pod ang RBC. Kay mag-adjust maka-adjust pa ang mga young RBCs sa size of the parasite. That is why enlarged and distorted ang mga RBC pag ma-infect sa Plasmodium vivax. For example here, this is an affected RBC of your Plasmodium vivax, and this is the normal RBC. So it has become bigger than usual. And also, take note of the Schaffner's dot. These are the kaning murag freckles niya class. Okay, kaning mga dot or what we call the eosinic stipplings inside the RBC. This is what we call the Schaffner's dot. So the macrogametocyte of your Plasmodium vivax, this is the thick smear view and the thin smear view. Okay? Ang kaning mga dot, ang mga blue, that is the Schaffner's dot. While this brown pigment, mo nitong ingon nato na hemozoin from the degradation of hemoglobin. Schizone. So, in this case, wala na tayo makita na RBC na part. Okay? Because the parasite has already invaded all the space of the RBC. And just look how big it is compared to the normal size of the RBC. All morphologic stage of Plasmodium vivax may be seen on thick and thin peripheral blood films. However, thin blood films are of the most benefit in species diagnosis. Blood samples may be taken at any time during illness. So, pwede dili maghulat sa chills or fevers or katong paroxysms. Plasmodium vivax characteristically tends to invade young RBCs because young RBCs are pliable. These immature cells are the primary target of invasion because they are typically pliable. So, maka-adjust pa sila, that is why magdako ang RBCs. Okay, epidemiology. This Plasmodium vivax is the most widely distributed malarial organism. Infection occur worldwide in both the tropics and subtropics. So patients infected with Plasmodium vivax typically begin to develop the symptoms of benign tertian malaria following a 10 to 17-day incubation period post-exposure. The symptoms mimic flu, nausea, vomiting, headache, muscle pains, and photophobia. These paroxysms typically occur every 48 hours, or the fever occurs every third day. That is why tertian ang term na to. Benign class because this is not as serious as other infection. Mao nang gibutangan og benign. Okay? So there are numerous anti-malarial drugs on the market, and it is important to note that this available malarial medication affect the parasite in different ways depending on specific morphologic life cycle stages present at the time of administration. Yan, so daghang available class na anti-malarial drug, but the most common and also the most popular today because of COVID-19, that is your chloroquine. Next parasite, the Plasmodium ovale. The common associated disease and condition is the benign tertian malarial also, or the ovale malaria. The typical Plasmodium ovale ring form is similar in most respects to that of Plasmodium vivax. The difference only is first, Plasmodium ovale ring is larger and also it is thicker. Pag ingon tag thicker class, kaning iyahang cytoplasm or kaning iyahang ring mas baga kaysa sa vivax and more amoeboid. The developing trophozoite maintains its ring appearance as it matures. The typical Plasmodium ovale immature schizone consists of progressively dividing chromatin material surrounded by cytoplasmic material, which in its earliest stage often maintain a circular shape. Plasmodium ovale mature schizone is characterized by a rosette arrangement. So, mas arrange na siya and katong murag halo niyang surrounding is wala na kaayo. Okay? The microgametocyte resembles Plasmodium vivax but only smaller, and this is also true to macrogametocyte. All developing stages of Plasmodium ovale may be seen in blood film preparation. Thick smears to identify the presence of malaria and thin smears to speciate them. Take note also that the Plasmodium ovale invades young and immature RBCs just like the vivax, and because of this, of course, the infected RBCs would then be oval and enlarged, and also ang sa murag unique lang sa ovale is there is a distortion of the walls kani class. Nahimo siyang rugged ang walls of the RBCs. But as you can see here in this picture, the infected RBCs are larger than normal RBCs. If your Plasmodium ovale has this Schaffner's dot, If the Plasmodium vivax has the Schaffner's dot, Plasmodium ovale has also Schaffner's dot, but other books refers to these dots as Jane's dot. So this stipplings, this is what we call the Schaffner's or the Jane's dots. Pero ang kaning brown class, that is still a pigment, that is still the hemozoin. This is the macrogametocyte from the thick smear, and this is the macrogametocyte from the thin smear. All developmental stages of Plasmodium ovale may be seen in blood film preparation. Thick smears to identify the presence of malaria, and thin smear to speciate them. The ring forms microgametocytes and macrogametocytes are usually difficult to distinguish, and this is why the mature schizone may ultimately be the morphologic form of choice for examination. Because class pareho man sila og nawong sa Plasmodium vivax, so ang ginagamit is the mature schizone form. Like Plasmodium vivax, Plasmodium ovale targets and subsequently infects young RBCs. It is primarily found in tropical Africa, where it apparently has surpassed Plasmodium vivax and in frequency of occurrence, as well in Asia and South America. The clinical scenario of Plasmodium ovale, including initial infection symptoms, time of typical paroxysm cycles of every 48 hours, and ang kalahian ng class is the Plasmodium ovale infection lasts approximately only a year, while Plasmodium vivax infection may remain for several years. Next Plasmodium is the malariae. So common associated disease and condition is the quartan malaria or malarial malaria. The typical Plasmodium malariae ring occupies approximately 1/6 of the infected RBC. It is connected by a heavy chromatin dot. So dako-dako ang iyang chromatin dot, and the vacuole may at times appear filled in. Pigment characteristically form early. So, pwede nang makita ang hemozoin in this early stage. The key characteristic of this morphology, the developing trophozoite, form that distinguishes is the formation of a non-amoeboid solid cytoplasm, potentially assuming a band, bar, oval, or roundish shape. Okay, class, ang malaria lang ang naing-aning nga form. Some forms may have a similar but dili siya yung ani ka prominent, nakanamura dyan siya band. Okay? The cytoplasm consists of coarse dark brown pigment, often masking the chromatin material. Vacuoles are absent in the mature forms of this stage. Pag makakita gani og band, ing ani automatic Plasmodium malaria dayon. The immature schizones are larger and darker ang ilang peripheral granules and may be seen in this stage ang kaning mga granules na mas dako-dako compared sa other two early stage. The merozoites in this stage are usually arranged in rosettes or irregular clusters. A central arrangement of brown-green pigment may often be visible in this stage. So the gametocytes of your Plasmodium malariae are similar to Plasmodium vivax but smaller and has a darker and coarser pigment. This also assumes the oval shape. So since the Plasmodium malariae only invades mature RBCs, This kind of RBCs are not very pliable. Mas gahi na ilahang cell wall. That is why, kung magdako ang parasite inside the RBC, the RBC would not change its shape. That is why normal size gihapon and no distortion. Okay? Makita diri class, this is the band form of your Plasmodium malariae. And as you can see, there is the coarser and darker pigment, kaning himozoin. And ang kaning mga dots na makita nato inside the cell, these are called the Zeeman's dots. So this is an infected RBC and this is the size of a normal RBC. So pare-pareha lang class. The ring stage is not commonly seen. The most frequently encountered growth stage of Plasmodium malariae are the developing trophozoite and the immature and mature schizones. Plasmodium malariae infects mature RBCs. These RBCs has well-established cell walls that are not conducive to expansion and also does not result in cell distortion or enlargement. That is why the parasite responds by forming bands or other shape as necessary to maintain itself. Plasmodium malariae is found in subtropic and temperate regions of the world. These infections appear to occur less frequently than those with both Plasmodium vivax and Plasmodium falciparum. The quartan malariae, this is a fever form of malaria where an onset of fever occurs in an interval of 3 to 4 days, hence the name quartan. So after experience an incubation of 18 to 40 days, followed by the onset of flu-like symptoms. The cyclic paroxysm occurs every 72 hours. Next is the Plasmodium falciparum. The associated disease and conditions are the blackwater fever, malignant tertian malaria, estivo-autumnal malaria, subtertian malaria, and falciparum malaria. The typical small, delicate ring form of Plasmodium falciparum consists of scanty cytoplasm connected to one or two small chromatin dots. So, pwede class na ring-like or headphone. Headphone ang ginatawag ani kay it has two chromatin bodies or chromatin dots. The Plasmodium falciparum developing trophozoite typically consists of one or two rings that each possess a heavy cytoplasmic ring that is thicker than in the preceding ring form stage. The immature schizone phase of Plasmodium falciparum is not routinely seen in peripheral blood and is only visible in those with severe infection, and also this is the same as the mature schizones. The micro and macrogametocytes of your Plasmodium falciparum are different than the other Plasmodiums. They assume a characteristic sausage or crescent shape, and other books says and describe this as the banana shape. Kalahian lang sa micro ug macrogametocyte is that the chromatin is dispersed in this kaning pink na part is mas dispersed siya, while in your macrogametocyte is more compact. So, the Plasmodium falciparum infects all stages, so wala siya ginapili. But all RBCs retains its normal size and no distortion of it. Except lang siguro for the gametocyte form, distort lang siya gamay. But all in all, it still has its normal size. So the dots for this Plasmodium is the Morse dots. Okay, this is the gametocyte in the thick blood film, and this is in thin blood smear. So kani class makita nato the crescent shape, the sausage shape, or the banana shape. Peripheral blood smears from patients suffering with a mild to moderate Plasmodium falciparum infections typically reveal only the ring forms and the gametocytes. Trophozoites and schizones are usually only visible in the peripheral blood of patients with severe infections. Plasmodium falciparum invades red blood cells of any age and may infect up to 50% of the red blood cell population at any time throughout the course of the infection. So infections occur in the warmer months of the late summer and early autumn, thus dito gikuha ang iyahang name na ay estivo-autumnal malaria. The geographic distribution of Plasmodium falciparum appears to be limited to the tropical and subtropical regions of the world. Plasmodium falciparum has a relatively short incubation compared to others, kaya pwede lang 7 to 10 days as compared to others na weeks to months or years. They exhibit early flu-like symptoms, the patients, and daily episodes of chills and fevers, as well as diarrhea, nausea, vomiting, and cyclic paroxysm, which occurs every 36 to 48 hours. So kung kanina, benign tertian malaria, we have here the malignant tertian malaria. So Plasmodium falciparum may also enter the kidney, brain, or the liver. Kidney involvement, known as black water, usually results in marked hemoglobinuria. And when you have hemoglobinuria, you have increased hemoglobin in the urine, and increased hemoglobin in urine would turn your urine into dark color, either dark red or black. That is why black water fever. The last Plasmodium species, the Plasmodium knowlesi. Plasmodium knowlesi morphologically resembles Plasmodium malariae and also Plasmodium falciparum depending on the morphologic form present. Clinical features of infected individuals range from respiratory distress, acute renal or multi-organ failure to shock, treated with quinine, chloroquine, and artemether lumefantrine. So that ends the Plasmodium discussion. As noted, there are numerous species of Babesia, and of those, 4 are known to be of concern. Apicomplexion parasite belonging to the genus Babesia are often seen infecting animals, wild and domestics. Babesial organisms were first described in the 1800s as being responsible for the Texas cattle fever or red water fever. So humans are usually considered as an accidental host only. The 2 babesial organisms most commonly isolated from clinical specimens are Babesia microti and Babesia divergens. The trophozoite form develops after the sporozoite infects the red blood cell. This form resembles the ring form of the Plasmodium infection. The typical ring, when stained with GEMSA, consists of a blue cytoplasmic circle connected with or to a red chromatin dot, also referred to as by some as the nucleus, and the space inside the ring is known as the vacuole. So ikato gihapon class, mura gihapon og ring form of your Plasmodium falciparum. The diagnostic feature of babesiosis can be differentiated from malarial organism by the absence of malaria pigment, so wala siyang hemozoins, or katong Schaffner, Zeymans, or Morer's dots, or Jane's dots. So wala siya dots or pigments. The merozoite resembles four trovozoite attached together by their respective chromatin dots in the shape of a cross, often referred to as resembling a Maltese cross. Okay, kanang murag chromatin nga DNA nyo makita class dira sa tunga kanang cross that is four chromatin dots in a shape of a cross. So the life cycle begins when an infected tick transmits sporozoites into the human. The sporozoites invade the red blood cells and develop into trovozoites. The trovozoites continue to develop into merozoites. The merozoites undergo binary fission to produce more sporozoites. And this kind of infection can also be transmitted through blood transfusion. Gemsa-stained peripheral blood films are the specimens of choice for the laboratory diagnosis of babesiosis. Wright's stain may also be used. The timing of blood collection for the study of babesiosis is not crucial to success in retrieving Babesia parasites. So, okay lang na kumuha ng dugo na not within the paroxysms or the chills or the fevers. So, we also use OIO in the microscopy for these slides. And, of course, malarial slide gihapon atong himuon, the thick and the thin. So, thick blood smear, una ang tan-awon for the screening, and the thin blood smear for the speciation and the differentiation from the Plasmodium parasites. Babesiosis is generally a self-limiting infection, and its onset is usually gradual and characterized by prodrome-like syndromes. This is the fever, headache, chills, sweating, arthralgias, myalgias, fatigue, and weakness. So the treatment of babesiosis often involves a combination of drug, clindamycin and quinine, atovaquone and azithromycin, diminazine and pentamidine, pyrimethamine and quinine. Okay, muna sila ang usually na combination of treatments. Okay, so that ends the Sporozoa, Plasmodium, and your babesiosis.